Today, the acting director of the CDC called for upending how children have been protected against measles, mumps, and rubella for the last 50 years. Jim O'Neill said he was calling for the MMR vaccine to be split into 3 separate shots. This comes as the CDC finally approved new guidelines for updated COVID vaccines. Joining me now, CBS medical contributor, Dr. Celine Gounder. Okay, Dr. Gounder, let's start with the MMR vaccine. Split them up. What does that mean? Is there an upside or a downside to that?
So MMR stands for measles, mumps, and rubella. The short answer to whether it makes sense to split up these vaccines is no. And I think it's important to note that the acting CDC director is not a doctor, not a healthcare worker, not a scientist. He's a lawyer. But there is no high-quality data to show that this would be safer or more effective than what we already do now. It would mean more appointments, more needle sticks for kids, and fewer kids completing the full series. And on top of that, we actually don't have these vaccines, these single disease vaccines here in the United States. So it's just not a logistically feasible kind of thing to be doing.
Wow. All right. I want to make sure I don't lose you on COVID. So what's the new guidance? What was said about COVID?
So we're moving away from the recommendation everybody needs a booster every winter. Okay. So it's instead of a blanket approach, it's more of a individualized risk-based approach. The catch here is that insurance coverage is also contingent on these recommendations. So some insurance companies could decide no longer to cover COVID vaccinations, and then retail pharmacies may not order as much vaccine for everybody who would normally perhaps want a vaccine. And finally, a third of Americans don't have a primary care provider, so may not even know if they have underlying conditions that put them at higher risk for severe COVID.
So because you're supposed to talk to a doctor, if you don't go to your doctor...
If you're 1 in 3 Americans who doesn't have a doctor to talk to about this, I don't quite know how you're going to get that information.